Welcome everybody to the Community Technical Assistance Center webinar on family engagement consultation. So I think we're just waiting for folks to kind of log on. We'll get started in about another minute. Thank you. There may be some folks that are still kind of logging on. Thank you everybody for joining us. This is the Community Technical Assistance Center, and this is, I think it's about our 6th webinar in our series on family alignment. And today's webinar is really a consultation webinar around caregiver engagement. So we're very excited to be here with you today. My name is Lydia Franco. I'm part of the CTAC resource team. Carradine Assail, Jason Jones, and Sandra Killett from Child Welfare Organizing Project will also be joining us as part of our webinar today. The focus of today's webinar is really to really have it be an interactive webinar, be able to answer questions that you have around utilizing best practices around engagement and engaging caregivers and services. We're going to have some times where we're going to ask you to answer a poll or to chat in some feedback. We have a little kind of mini case study that we hope to show you if the video works well. And if not, we can talk through it, or we also want to be able to open up and have you share some case studies of your own, any specific questions or concerns that you have. So really spend a lot of time on that as opposed to presenting content. Just to orient you, in case this is the first time you're on our webinar, everybody's currently muted. You have on the right-hand side a chat box. If you don't see that chat box, you can click the little bubble that says chat at the top right, so that box pops up on the bottom right. If you want to send us some comments, some feedback, respond to our questions, make sure to write in that box on the bottom and click from the drop-down send to all panelists before hitting send. That way we can see it all. If you only send it to the host, only the host sees it, but the panelists don't see it. So if you can be mindful of that, that would be helpful. We'll have at least one poll question that'll pop up, and that'll pop up on the right-hand side for you to reply to, and we'll walk through that when we get there. So thank you again for joining us. I'm just going to, the brief agenda that we have is that we're going to do just a quick overview of the topics we've covered, and then really kind of hopefully go into that case study and have a lot of opportunities throughout to answer questions and to also think through some of our next webinars in the series. So up until this point, we really have done a series of 2 webinars on the first 30 days, that critical time when you first meet a family to engage, but to assess and evaluate and to develop treatment plans and the critical components that need to happen within those first 30 days. We then also spent some time recently on 2 specific webinars geared towards engagement strategies, both to be utilized at the beginning of services but also throughout. And we were also very lucky to have folks from the Child Welfare Organizing Project present a second webinar on specifically working with child welfare involved families. So we're going to just kind of touch base on some of the key points across those webinars in just a moment. But we wanted to also just check in with you. One big piece from those webinars, and I'll show the checklist, was that we made available to you on our website, along with the recording and the slides, a checklist that you can utilize to help guide you in your initial engagement and sort of self-assessing how well you're able to implement some of those best practices. So a poll question popped up asking you if you've been able to utilize that checklist. So you can hit yes, you can hit no, or maybe you're thinking about it, or maybe it's the first time you've heard about it. Just let us know kind of where you are on that process. If you don't know what that is, that's fine too, because we'll probably spend a little bit more time explaining it as well. So if you can just reply to that poll and then hit submit, and then in about a couple seconds, we'll just show the results. There's sometimes a slight delay. Okay, so the results for that poll will pop up momentarily. Great, thank you so much. So there's at least a couple of you that have utilized it or thinking of utilizing it. Some of you don't know exactly what it is, so I'll just spend a few seconds showing you that. If for some reason, if you don't see the full file, you may have a scroll bar where you can scroll yourself up and down if for some reason you're not seeing what the full page. But essentially, what we had created is after giving all that information around important things that really are helpful to be accomplished in those first 30 days, important best practices around engaging families, what we created for you was a tool that was really kind of a checklist that you can utilize to help assess where you are in this process. And to help you think through, are you really implementing all those best practices? Are there some areas that need some tweaking? Are there some areas that maybe we're not doing at all or we didn't consider? Or are you really doing most of those things and you're doing pretty well? And the second part of the checklist at the bottom has this action step for improvement that helps you to kind of think through for the areas that you feel need some improvement, what are the best steps to start implementing those things right away? So we made that available at the beginning of this series, and I mentioned it periodically. It's available on our website at ctacny.com under the Family Alignment Series. We highly recommend that you as providers take a look at the tool, see if it's something you can utilize as you're meeting with families. But we also recommend if there are any supervisors on the webinar as well, that it's something that you can also utilize as part of supervision with your staff to help kind of evaluate as to how well folks are implementing some of these things and what are some areas that you as a supervisor can help support them on. And so we just wanted to spend a few minutes to help acknowledge that there is that resource there available to you that may be helpful. And then we're going to move on. And Brianna just kind of chatted the link that if you're not sure where to find it on our website, you can click on that link and it'll pop up in a separate window. We want to open up the webinar now just to ask you some questions. So there's at least a couple of you that said that you were thinking of utilizing the tool or have utilized it. I would love to hear how it's going in utilizing the Family Alignment tool. Have you found it to be helpful or not? Getting some feedback would be useful. But I also wanted to know if there's any tools that others are utilizing. So the checklist is one way of assessing and evaluating how well we're engaging caregivers, but are you utilizing other things that are helping you in this process, whether it's guides or brochures or a specific model that you utilize that supports you in that process? If you can take a second and chat into us on the bottom right and send to all panelists, that would be really helpful to hear as to kind of where people are in utilizing it. And if some of you have not utilized any tools whatsoever, would using like a checklist be helpful? So please just take a second to submit some of those responses to us. And as a reminder, we really want today's webinar to really be about question and answer, about attending to your questions, concerns, your experiences a little bit differently than just giving content and information. So just take a second and chat in and give us some feedback on those tools that you've utilized. Thank you so much. So please keep coming. They're coming. Sometimes there's a slight delay in getting some of the responses, so please keep sending them. So, for example, we have somebody who says that they use information sheets that are given to carers at the first session to help them understand more about their child's diagnosis and some information about treatment. That's really helpful. So is that more of, I think that was Michelle, it'd be helpful to hear if that is more about orientation. Is it specific by diagnosis? Hearing a little bit more about that would be helpful. We have others that say that they'll conduct workshops or have brochures that they give to families, and others that use, I guess, other types of assessment tools. in that process. So giving me, if you can send in as kind of we move on, what are some specific points and some of those tools that you've utilized that have been particularly helpful in engaging caregivers, that would be helpful. So what about those information sheets, or what about those brochures or assessments have been helpful? So please keep using that chat. I think it's really helpful to hear that where everybody is and what everybody's doing, and to share that information with others. So thank you, Michelle. So Michelle replied, we also really like the treatment planner tool, and rather than using it for each client, we've been working together to complete it by diagnosis, so for clinicians to use as a rough outline of the course of treatment.
Wonderful. That's so ideal.
Yeah, thank you so much, Michelle. So that treatment planner tool was some of the handouts that we've also have available for you to utilize. So that's really helpful to guide the process. And others have just in-depth family functioning assessments maybe that help support and guide that process as well. So thank you everybody for participating. That's really helpful to understand where everybody is in this process. So to give a little bit of an overview, engagement is about motivating and empowering participants to recognize their own needs, strengths, and resources, and to take an active role in changing their life. Engagement, and this is really the stance that we took in our series, is that engagement is essential in the provider-family relationship from the moment a family is considered for treatment until they terminate or are discharged. So I think that is sort of our particular sort of viewpoint, our overarching sort of framework as we're developing and continuing to work with you on this webinar series. I have a couple other folks that chatted in.
So thank you so much. I really love this comment that just came in. One of the biggest things we've learned from the work is that we need to instill hope throughout the process. And you're realizing that you do this somewhat but need to do it more. I think that's wonderful. I think that is probably one of the biggest takeaways from all of the engagement work, is that instilling hope with caregivers and children is so important.
Yeah. And others also say that they use carbon paper for notes at meetings where families involved, so that the family gets the original. So that's really helpful, and I think that's coming from some of our family support partners in the state, that the family also has their own notes. And I mean, I think also that encourages transparency in that process, which is also engaging. I just wanted to highlight briefly some of the barriers that we also talked about that are pretty common, and it would be helpful for us to know some feedback on how are any of these of particular concern right now for you in working with families. And obviously, you know, the barriers that always come out first are sort of those concrete barriers: transportation, time constraints, childcare, other priorities. But we also paid particular attention, and Sandra from the Child Welfare Organizing Project is here with us as well, who I think spent some time talking about sort of the perceptual barriers. What are those expectations? What are those preferences? What is perceived need? Are they experiencing stigma? You know, have they had negative prior experiences? I'm sorry. What are those challenges that maybe also can be getting in a way that is a little bit more complex but involves a little bit of a deeper discussion than practical barriers? And then there's also specific issues to mental health, challenges that other family members may have, cultural issues, and we spent some time really talking about that, and some challenges around language, around race ethnicity match, around whether do we really understand each other's beliefs and traditions, and what is the cultural relevance of the program, agency, and worker. And then we also have to acknowledge that the reality of this work is that there's a number of systemic challenges and organizational challenges and policies and procedures that sometimes also get in the way of engaging families.
So I'm wondering if those of you on the line, if you've thought more about these barriers, and if you've thought of other ways to attend to the barriers. I know we did, in one of the webinars, we did a role play with Jerry and myself and Jason, and we addressed some of these cultural barriers. I'm wondering if you've had a chance to think some more about the barriers and attend to them anyway. If you could chat into us, that'd be really helpful. Barriers get in the way, and as we talked about, those perceptual barriers are most important, but all of these barriers are very important at the same time, and I'm wondering if you've thought about other ways to attend to them, because I remember all of you could identify with them. So I'm wondering if you were able to attend to them in any way differently than before. That'd be helpful to hear.
Okay, great. And we have some comments coming in. Thank you.
So, yeah, we've been talking a lot about not just assessing barriers at the beginning of treatment, but the need to continue to assess and discuss with the families throughout the treatment process. That's really huge. So as engagement is not just something you do in the beginning with families, attending to barriers is also something that needs to be a continual process as well. So thank you for sharing that. We've talked about incorporating relapse prevention talk into the beginning of treatment so that clients and participants will be encouraged to stick with us even after things start to get better and treatment becomes more inconvenient. Absolutely. So those bigger barriers that may occur throughout treatment, how can you prevent them taking over and really interfering with the treatment? That's wonderful. Thank you so much.
And we also spent some time talking about the successful process of involving caregivers. And this is just a great summary slide, as we had mentioned in those webinars, that you may be helpful when you access the slides from our ctechny.com website to be able to kind of print this slide in particular, because I think it's a really great summary slide, and I'll give thanks to Dr. Susan Stern, who helped kind of create this and allowed us to adapt it and utilize it. But I think it really highlights the important points. So some of you, I think, Michelle, you mentioned instilling hope and the importance of doing that. And I think we also highlight the importance of doing that at every contact with families. So instilling hope, tap into those hopes and dreams. And we also talked a bit about making sure that the caregiver feels respected and heard, that we're using some of our reflective listening techniques and using validation techniques to understand and empathize with the family's experience, really focusing on strengths as opposed to kind of problems and what's not going well is also typically a really helpful and useful approach. Working collaboratively around goals and clarifying what does the caregiver feel that is important to address? What is it that, what are their felt needs in this process, and how can we come together around those, as well as attending to barriers and concerns, as we had talked about, and having some of those conversations earlier on to attend to them, but also bringing them up periodically. And this is just another way of kind of looking at it, is just even, and I just want to highlight a couple here, like fostering the resilience, so that acknowledging that there's quite a bit of resilience that families and caregivers really exhibit and show if we're able to kind of recognize and focus on those strengths. Being able to provide the positive feedback and reframe challenges that folks are experiencing. Cultural and racial differences between the provider and family, and trying to attend to those, discuss those to prevent the misunderstanding, as well as creating opportunities for participants to ask questions. And that really attends to getting feedback, like really creating a culture of feedback where families really feel comfortable talking about some of those concerns that they may have about the services that they're receiving, and being open on the provider side to get that feedback and to be able to adjust the work that we're doing. Sandra is going to talk briefly, summarize briefly what she presented at the last webinar with this side around some ways to support child welfare involved families.
So thank you for having me again to do an overview. So I've been kind of listening, and I just wanted to say that I'm hearing some things that honestly I'm sitting back saying if I was a parent receiving service, this would be helpful, right? So the idea that you're thinking about when things get better for me, that I might come back if things are not well at a time. And that means for me that you've built a relationship and you're thinking about wanting to have a relationship, so that's really great. So anyway, I'll just go through some of the ways to support child welfare involved families. And the first way would be to get clear and honest about information from the family. Really, you really have to talk to them and let them know why you're wanting to have all of this information. And not to assume that they really know why, I think would create a lot to involve families. Helping families to get over the stigma of being involved with the child welfare system. I think that also goes a long way. It's not easy trying to get over being involved even after you're not involved, right? So when you're in the midst of it and you're going through that treatment plan, you're still holding out a bit much, even though you know this might be a place that would help you and your family. So knowing that that stigma of being involved is real for families. Knowing exactly what families need for their families. So really hearing families, and sometimes it's not just hearing, it's actually kind of observing and assessing what they need, because they might not even tell you what they need, again, for fear, a stigma, not knowing how the information is going to be used. So I would say not being afraid to say that, you know, you're thinking the family might need this, or, you know, you think that there might be a struggle in this place, you're not sure, but you want to get them to confirm that for you, so then you can actually help them continue to build their protective factors. And I know I mentioned protective factors, but Lydia mentioned one of the protective factors, which is resiliency. And I think letting a family know that, you know, they're going through something. Yes, there's a storm, but they're resilient because they're still going through it, right? And you can build on that. And looking at their social, emotional supports that are in place, that's another protective factor. So they might already have some things in place. So don't overlook those, right? Because there's strength in everything that we do. And often families overlook them themselves, and you can help them point those protective factors out. Some they may have really strong protective factors, and some they might need some help in. Might be the relationship at the school, might not be a strong relationship at the school, so you can help them to build that relationship. And again, that's another one of the protective factors. And then, of course, not overlooking the fact that if they're involved with the child welfare system, it is likely that they may or may not have good legal services involved. And that will come into play when you're having that discussion. So you may not be able to move to the next point that you want to move to until you actually address that, because it might come into the discussion that you're having with the family about child welfare. And I think if I could say anything at all, I would really say just be open, be honest with the families that you're working with, and be empathetic and let them know that you're there to help them move through the process, and I think that'll go a long way. So thank you for listening to me.
So I think we're going to ask folks for their questions, but I think a good way to think about this is that as you help to support and collaborate with folks, let them know what their rights are, which Sandra spent quite a bit of time in the last webinar talking about rights that child welfare involved families have. That also is a way to engage the caregiver, because they know that you're partnering with them, collaborating with them, and supporting them in getting through this process in a way that's meaningful and hopefully doesn't become as negative as it has been for some families. We wanted to try something. I'm not sure if this is going to work, but, you know, if you remember from some of our webinars, we had a little bit of a role play. We have turned this into a bit of an animated video that we're going to try to show. I'm not sure if it's going to work so well, so we'll try it. If it doesn't work, we'll just end it and we'll make it available to you on the website so you can view on your own. But I'll have Kara kind of introduce it briefly.
Yeah, hi everyone. So this is the case study that we presented in the last webinar where I was playing the therapist, and Jerry and Jason were the family that I was working with. Jerry is the caregiver and Jason is her son. They're an African-American family who've been attending the clinic for the past 6 weeks. Jerry, who's a single parent, works full-time to support her son, who's 10 years old, but the school has been calling continuously due to him acting out, being disruptive, and fighting with other children. Jerry does not see any of these behaviors at home, so she's a little confused but concerned about her son and becoming quite frustrated with the school and the therapeutic processes, and also it's starting to interfere with her work and her job. The family began working with Miss Yvette, who was an African-American therapist who Jerry really connected with and felt that Miss Yvette easily related to them. And then they came to the clinic, which was our role play, where I was there because Miss Yvette had to leave. She was no longer working in the clinic due to personal reasons. And so I took over. So Jerry expressed her concerns working with a Caucasian therapist and decided to see how things went. We had a great conversation. Unfortunately, we couldn't play out the entire 60-minute session, but I think we had a really good start to things. Recently, the school has caught, so what we want to show you is a continuation of this relationship and the dialogue. Recently, the school has called Jerry, and she's becoming more concerned with the lack of progress that they've made and is starting to feel overwhelmed. She asked to speak with me as a therapist individually to express her concerns. So what you're going to see, hopefully it works. We're crossing our fingers here. This is something new we're trying. Brand new off the press. So what you're going to see is Jerry and myself. We don't look like this, but this is the cartoon version of us, and it's a snippet of our latest interaction around talking about her concerns and our work together, really focusing on Jerry seeing, we'll talk about it, but just so you know, Jerry has some concerns, and we'll talk about it after if you can see it.
So if we're able to view the video, I think what we're going to ask is for folks to make sure that your computer speakers are turned up.
Yes.
Because it isn't necessarily coming through the phone line, it's going to come through your computer speakers. So make sure those are on and up, and then we'll try it out. And if it doesn't work, we'll just end it, or we'll just cut the video and have it available to you on the website. So let's give this a try. Just chat into us if you're having difficulty viewing or seeing it, because that'll help us know when to turn it off.
Okay, so I'm sorry to Trish and others who weren't able to see it, but for those of you that were, do you have any feedback or any questions? We'd love to hear from you.
So we have some guiding questions here around what engagement strategies did Kara use? Is there anything that you think could have happened differently, or how would you further that discussion? So of those of you that were able to kind of hear or review that, you can let us know what some of that feedback is. Is it something you would do? Was it helpful or not? That would be. And so I think Brianna also just for those who can't see it, we will have it posted on the website for you to see.
So Michelle really appreciated the reflective listening and good summarizing of mom's concerns and good display of empathy. Thank you, Michelle. I tried to be empathic with Jerry, you know, as her therapist during this little snippet. I did not want to go away from her concerns of our work together. I could have easily, you know, escaped that and just hoped that she was going to come back the next time. But in good ethical faith, I couldn't do that because I knew she was concerned about that deep down because she had expressed it earlier. And so that's part of those perceptual barriers that are so important to attend to. Ms. Kara mirrored the client's feelings, challenges effectively, says Andrea. Thank you, Andrea. And I also wanted to start where her concern was. You know, we've talked about meeting the caregiver's felt need. And one of her felt needs was, you know, Jason and how he's doing in school and this disconnect around school performance and school behavior versus home. And I thought it would be great if I, as her you know, therapist, as their therapist, could go to the school and really get a sense of what's happening. And so I think at that point, you know, Jerry and I were role playing, but we really get into it. And I thought she was going to be a little bit fearful of me and put up a little fight. But once I said I was going to go to the school with her, it all changed. And I could tell that she was much more open to our work together as a result of that and really could feel that I was with her every step of the way. And that was one of the big messages I wanted to convey to her, which is what Sandra just had said to you. You know, if I have anything to say to you, to be empathic and let caregivers know that you're there with them.
Yeah, and so others have kind of written in saying, you know, that you were what you kind of reiterated what you just said, where you're meeting the client where she's at and what she's actually feeling, and that you really showed like a sensitivity to her concerns, which is really helpful. And I think the other thing that kind of also stood out was that then maybe looking at goals again, that there's a bit of a disconnect between what the caregiver feels is needed in services and maybe what the school is saying, what others think she may be needed for her. She's not feeling that there's progress happening, so that's a concern. So there's a number of, you know, sometimes difficult questions to have around, you know, do you think this is helpful or not? Why not? Where do you think progress is going? That I think Kara helped facilitate that conversation away. But, you know, it can be done in a variety of different ways, but the main thing is to really have that conversation.
So thank you for participating in one of our new options here, and it's CTAC. I want to let you know that our Jason Jones, not the 10-year-old boy Jason Jones, but our Jason Jones here really created that, and he spent a lot of time on it, so I wanted to thank him. So we're going to move on.
So we wanted to open up, so we have quite a bit of time in our webinar. We did a bit of a review, wanted to continue that case study, wanted to open up to questions from you around specific to engagement. So a few of you have been chatting in around things that are working. We'd also like to hear some things that may not be going so well, or if you have a specific case that you want to mention around how can we help kind of problem solve with you, how to engage them. You know, Sandra also is here with us. If there's a family that is child welfare involved that you're really having some specific concerns about or challenges with, please take a minute to chat in those questions because we'd be happy to attend to them. If somebody is willing to be unmuted, if you raise your hand, there's a little hand button icon above the chat box. We'd be happy to unmute you if you'd like to actually speak to us directly. So there's a couple options here. So let's just take a few seconds or so as we wait to see what some folks' replies and feedbacks are. We do want to spend as much time as possible really helping you kind of think through how best to apply some of these strategies in difficult situations. Okay, so I think it would be really helpful to hear some of your specific case examples, concerns, questions. If you have a second to just chat those in, sometimes there's a delay in us getting them. We also have some questions that had been sent to us previously that we can go over, but I think we're finally getting some in. So,
a family who's very private and very reluctant to get outside help or resources despite the need. That I have heard that before, and I've experienced that myself. So someone who's coming in and seems to have a need for either the child is not doing well or whatever the circumstances, but the family is pretty closed and hesitant to get any other help. Do you have anything to offer around that, Sandra?
I would say, I know first and foremost you're saying that they're private, right? Mm-hmm. But there is something about being private and receiving information from someone else, another parent that's already been affected, or someone who's involved with your services. And that's truly an ask, right? So you would be asking, you're not going to break any anonymity or anything like that, but, you know, you might want to ask, you know, there's, or just state, there's plenty of families that go through this. You're not going through this by yourself. I work with families. If you know someone that might be willing to talk to that person, just to talk to them about just being involved, not about their situation, not about what's going on, they might actually open up and become involved. But it would have to be an option. It's not an option that they're going to think of on their own. And I think also, you know, finding out what is the private about it, I think, is where I would go. What's the private about it, and digging deep? Is it about actually being in session? Is it about being affected by the child welfare system? Is it about being sent here, diagnosed or not diagnosed, or, you know, it's really, when they say private, I really think you gotta try to dig deeper to find out what it is. And don't leave yourself out either, right?
Yeah, I would say what is, it could be the relationship with the provider. But it's also the reluctance, I think it's sort of, so what is it that is occurring? So I would wonder, though, in those cases, is what is it that they expect is going to happen? Have we oriented them enough to the services and what treatment, whatever services we provide, because not everybody on here is necessarily providing therapy, but what services we provide, and is there a clear understanding of what they are? Do we have a clear understanding what the family's needs are? Maybe they think that actually the referrals aren't what they need, and that's a very valid, you know, question. And so kind of having a conversation around that, what is it that's really happening? They could have had bad past experiences. Maybe the previous provider they worked with really, you know, didn't understand them and created more problems for them than helped them. So processing some of those kinds of perceptions, I think, is particularly going to be helpful in trying to understand where that reluctance is coming from.
Yeah, I agree.
I'm sorry. And if there is a clarity about whatever that private is that comes out, what do we really have to relate externally, right? Because we know that there's some private stuff that we have to relate outward, but, you know, trying to get to the root of whatever we're talking about in here is what we're talking about in here, unless it is, you know, you're going to hurt yourself, hurt someone else, or, you know, it's really explaining that as well, I think.
And sort of along those lines, I just want to offer a reframe. That often when we have family members who are private and seem to be somewhat reluctant, that's actually a coping mechanism, right? So it's probably some insight into the way that they're coping with some stressful things that are going on, and it's not really a bad thing. It's a way to stay safe and to keep their family safe. And so I just wanted to reframe that for a minute.
And and Sandra was just saying trust, so that there's a bit of a trust building process that may need to occur prior to be able to get them connected with other things.
Our clinic is, another concern or question came in, is our clinic is focused on productivity for billing purposes. They could not attend meetings with families. Any ideas? Yeah, the challenge of time and demands. That's a really big one.
Are they saying none? Well,
go ahead, you can ask.
I'm wondering, are you saying none, or would you be able to attend some? Because sometimes it is what's the priority appointment that you might need to attend with them. And then maybe explaining that to the family, right? So you may not be able to attend all. You may not be able to attend maybe 2. But based on the work that you're doing with the family, what would rise as a priority? And then you might be able to fill those other spaces with some community-based program or some other person who have been affected by that system. And there's plenty of them out there in the community-based. For example, like if you have a person that's in a shelter, there are advocates in the shelter system. So, you know, there's different things that you might be able to refer them to, different places you might be able to refer them to. If it's a hospital situation, you have patient services, you know, and the list could go, just seeing if there's someone else external to you that might be able to support them.
Yeah, and I think
filling in the gap.
Yeah, filling in the gaps. But also, you know, part of the productivity is that, you know, we are able to have family therapy. We are able to do appointments with families in a variety of different ways. So there are ways of putting them in there and thinking a bit innovatively with using families or working, collaborating with families to better serve the child. I'll put a little plug in for our next set of webinars, which is going to be on caregiver involvement strategies. So how best to utilize caregivers in the active parts of treatment will be our next webinar on May 6th. And I think for those who are struggling with trying to balance the productivity demands with the attending to the family's needs, I think that may be a helpful webinar to think through in terms of how best to work with them in attending to the child's mental health concerns.
And would it be a possibility to say that if you have that external resource, maybe the external resource can come to
No, yes, absolutely.
Yeah.
So, and I think, and so, you know, there are others have also kind of replied, chiming in, saying that there are codes that you can utilize to meet with families with Medicaid use complex care management. And I think also the system is moving forward also to thinking through how to work with families, how to do more home and community-based services earlier on in this process, how to engage family support partners and family peer advocates, as well as youth advocates as part of this process. So I think the hope that is as we move forward, we're going to be seeing a lot of those family-focused interactions and as part of the billing system
with the goal of family-driven care.
Yes, exactly. Great. So we wanted to also check, there were a couple other questions that had come to us previously. I want to kind of mention those, but please keep submitting your questions and your comments. You know, so I wanted to kind of highlight a couple that are on this list. Do engagement techniques differ between single and 2 caregiver households? How should we approach caregivers with different levels of engagement? So I think oftentimes we have those experiences where, let's say it's the mother that brings them, but the father doesn't agree, or there's a grandparent involved that doesn't agree, and then it's harder to engage them because they're also struggling with the family conflict around that. So I'll pass that to the group to kind of give suggestions on how do we work in some of those situations.
Well, you know, the first thing I would say is we're all here for the child or the youth or the family. And if we all have a responsible role, you might have to have a family meeting and try to figure out what each other's understanding is. So we might not agree, but for the sake of what needs to happen, we need to at least come to an understanding. And sometimes families can't navigate that on their own, right? And you might have to play that role to help them navigate that conversation.
And help everyone get on the same page.
Everyone get on the same page.
And there may be a slightly different engagement strategy for the different, you know, caregiver. So, you know, one may be more open and amenable or understanding, another one may need a little bit more time. But I think the same core concepts are the same. You focus on strengths, you instill hope, you validate. There are real concerns. Oftentimes, I know when in working with families, oftentimes the other caregiver either was concerned about the stigma, didn't believe in mental health services, didn't think it was necessary. So really, I think it's a lot of the same conversations to be had. It's just also being mindful of the fact that if they're a significant caregiver, the child spending a lot of time with that individual, we may want to consider bringing them in as well. I wanted to highlight another question that is also common is, what are some specific strategies for getting clients to comply with provider recommendations?
Take out the word comply first.
I
think comply is that sounds a little like if you don't do something, something's going to happen, right? And most of the time there is, right? So if you don't follow through with the recommendations. But I think looking at the provider recommendations and trying to see what is it, what are you having difficulty with, right? Why can't you move into the recommendations, or why can't you begin to do what we've agreed, because we've come out with a plan. In some cases, there's some things that you can contribute to the plan, and then there's other things that you just can't contribute. But it's about letting the family know, you know, why these are the recommendations, and what's the hope for you and your family by you engaging.
Yeah, I mean, I think a question that I would have is, do they agree with your recommendations? Because so we shouldn't be necessarily working on getting clients to comply with them. That usually means that they don't agree with what we think the goals should be or what we think they should do. And I think we spent a bit of time in our previous webinars really kind of talking about how that's really not the best approach, and that sometimes providers don't have the best approach. Like, you know, there's a lot of experience and knowledge that we bring to the table, but there's a lot of experience and knowledge that the families bring to the table, and in the end it has to make sense for them. So having that conversation around, are we really collaborating on the treatment planning and goal setting? Or, as Sandra said, if it's something that you agreed on originally, you know, sometimes people's needs change. So kind of maybe it's an opportunity to actually have a conversation around, is this really what you feel your goals should be at this point in time, or do we need to adjust them? What do you think would be helpful in working with your child? What do you think your child needs or your family needs at this time?
Yeah. And I think what this is indicating is some kind of misalignment. And so going back and thinking about how do we really align with caregivers and meeting their felt need. I mean, I know it's a challenge when our job is to assess and help, and that can be done so much more productively with family members and with caregivers every step of the way.
We have a couple others. Let's see which ones maybe we haven't covered. Working collaboratively with other providers sometimes is a bit of a challenge. And I know as we move forward with some of the changes to the KID system, we're also going to have to, I think, work more collaboratively and work, there's going to be a number of different programs, work across systems, work with child welfare, for example, and coordinate services more appropriately.
It is a challenge. You know, I work on another project where there's someone in a residential program and who was doing very well in treatment and really meeting all the goals that they had been working on, and then did something, I guess, one evening in the residential and got kicked out. The clinician was not notified around this, and then the participant, the client, and the family just stopped showing up, and they had no idea why until they further investigated. So this is an example where leadership maybe needs to come into the picture a little bit and to think about that coordination of care at a top level, because it is affecting the outcomes of the child and family. So I completely understand that challenge.
Yeah, and sometimes that's collaborating within one agency that has multiple programs, and sometimes it's collaborating across agencies. But I think, you know, I think one recommendation is to kind of really think through what those collaborations look like, and that we need communication and clarity.
Consistent kind of communication.
Consistent communication and clarity. And some of those relationships may involve a little bit of work. I remember having to spend some time coordinating with case managers, for example, or waiver services when I was in clinic, or vice versa. And child welfare in the city ACS, really trying to just make sure that we were all on the same page and working together. So that can get complicated, but I think definitely doable.
Well, you know what's good about that, if I could just add, is that when there is a difficulty on at the residential treatment facility, right, you may have a tool that actually works with that young person that I may not know about, and then you can give that to me to help me utilize it. And it's the same thing when they go home. And often that does. There is that conflict. But I think that, I mean, that would be ideal, right?
And that the expectations are set up from the very beginning, that there's that communication and consistent communication. Even if it changed. So in this case, there were a lot of changes of workers and such. But even if that happens, that there's still some kind of consistent communication, I think is really ideal.
So I think we'll do one more question. If there's any kind of final thoughts or questions from folks on online, please submit those now. But we have one which I think I may brought in. The original question was, can you discuss engaging the caregivers of juvenile justice families? In theory, the general engagement practices should apply. However, in practice, we're just not finding that to be so. I'm wondering, you know, I have just a look at the group, and if there's others online who want to also chat in replies or responses or your experience in working with juvenile justice families. But I'm also wondering, you know, that this idea of, like, in theory, these practices should work, but the reality is sometimes harder. Any sort of recommendations or feedback on that level, or maybe specific to juvenile justice if we have any? So,
I don't, with juvenile justice, it's almost, for me, it's a step away from the criminal justice system. And we have a certain way of dealing with that population, right, even though it's juvenile justice. And I think if we would just, the bottom line is that they're a young person, they're not an adult, although they might have done something that got them into that place, they're still a youth, they're still a young person. And that's really how we should be dealing and relating to them, right? And that their developmental process is really not there. And it's almost like when we deal with juvenile justice, we're thinking that they need to be far more advanced in whatever they're doing, and that's just not the case, right? They're still a young person. So why is the expectation just because I might have done something? And I think that's difficult, and I think, make no mistake about it, that stigma is there as well. That stigma is there for the family. That stigma is there for the youth. The stigma is actually there, and we must help to understand that it doesn't have to be forever your life. And I do know that they have advocates and things.
Yeah, that may be helpful to engage as part of that process. I mean, I think anytime you can engage with peer advocates, I think that's an important engagement strategy and a wonderful support to families and to the youth. Do others want to add anything? Okay, so I think what we'll do is we'll move on. We're getting close to our time. I'm just going to thank everybody for participating in today's webinar. Thank you so much for sending your comments, your feedback, and thank you to the presenters today as well for taking the time. I just want to highlight that we have a couple more webinars in this series. Caregiver involvement strategies, that's how to engage caregivers in the active parts of treatment, is May 6th from 12 to 1. We have caregivers and kinship care, so that is particular to working with families where the child is in some form of kinship care, you know, primarily maybe with grandparents or other types of relatives, but it's really kind of looking at and working with those families a little bit differently. That's May 20th from 12 to 1. And we'll have our final consultation webinar where we get to kind of really interact with you and have answer any questions or concerns around implementing some of the strategies or even share successes. Will be June 10th from 12 to 1. So I'm just going to share our email. Thank you, everybody, for participating in today's webinar. Make sure to check out ctacny.com to access the recordings and slides from all the webinars in the series, as well as the checklist and additional tools and handouts that we've been showing to you through these last couple of months. So thank you again, and have a wonderful day. Bye-bye, everyone.
Bye.